السلام عليكم ورحمة الله. مرحبا بكم مجددا في محاضرة جديدة من سلسلة محاضراتنا مراجعة أسئلة اختبارات البرومترك. Review of Prometric Test Question. This is lecture number 1 in leadership. Today, inshallah, we are going to discuss 10 questions from question number 172 up to question number 181. معكم محمد عثمان يحيى. نبدأ مباشرة. Question number 172. On orientation day, a nurse educator said to a new nurse, "Our hospital provides the highest level of specialized healthcare in an integrated educational and research setting. Which of the following aspects of the hospital strategic plan is indicated by this statement?" The options are number A, vision, B, policy, C, values, D, mission. وقف الفيديو هنا واختار الخيار اللي بتشوفه سهل. The correct option is option number D, which is a mission. ليه اخترنا الخيار رقم D؟ نشوف rational. This statement, "Our hospital provides the highest level of specialized healthcare in an integrated education and research settings," indicate the hospital mission, because mission is describing what the company or hospital actually does. So the correct option is option number D, which is mission. Regarding to the others option, number A, vision. Vision is a statement describe what hospital will become in the future. And regarding to the option number B, policy. Policy is a set of ideas or a plan for what to do in particular situation. And regarding to the option number C, value. Value is a statement defines how people in hospital should behave. Example, accountability, transparency, collaboration, and so on. So the correct option is option number D, because this statement indicate a mission, not vision or policy or value. Question number 173. A head nurse of an intensive care unit wrote a report about the needs of her department and gave it to the nurse supervisor. Which of the following types of communication is this? The options are number A, upward, number B, horizontal, number C, diagonal, number D, downward. وقف الفيديو هنا واختار الخيار بتشوفه سهل. The correct option is option number A, upward communication. ليه اخترنا الخيار رقم A؟ نشوف راشد. Upward communication is a communication in which information travels from the lower level to higher levels in an organization or hospital. So the correct option is option number A, because the communication from a head nurse of an intensive care unit to the nurse supervisor, which is a higher level. So the correct option is option number A. Downward communication is a communication in which information transfer from higher level to the lower level in an organization. And horizontal communication is a communication in which information transfer between the individual at the same level in the organization or hospital. And diagonal communication is a communication in which information transfer within different level and different department of the organization. So the correct option is option number A. Question number 174. A head nurse of a coronary care unit delegating staff scheduling to a senior nurse in that unit. Which of the following steps must the head nurse implement before delegating tasks? The options are number A, negotiate with the senior, number B, take signature of senior, number C, explain task to senior, number D, make sure hospital policies for delegating tasks. وقف الفيديو هنا واختار الخيار بتشوفه سهل. The correct option is option number D. ليه اخترنا الخيار رقم D؟ نشوف rational. From the principles of delegation, the registered nurse should consider facility or agency or hospital policies and procedure before starting the delegation process. So the correct option is option number D, which is make sure hospital policies for delegating tasks. Question number 175. A 45-year-old patient has a colostomy bag attached as a result of vein mass removal. While conducting the discharge teaching session, the nurse assessed the patient's wife's understanding of the teaching. Which of the following steps of nursing process is exercised here? The options are number A, implementation, number B, planning, number C, assessment, number D, evaluation. وقف الفيديو هنا واختار الخيار بشوف سهل. The correct option is option number D, which is evaluation. ليه اخترنا الخيار رقم D؟ نشوف rational. Think about the steps of nursing process and that the nursing process has 5 consecutive steps: assessment, diagnosis, planning, implementation, and evaluation. And recall that the evaluation is the final steps and it is an assessment process to ensure the desired outcome has been made. So, the correct option is option number D, because the nurse assesses the patient wife understanding after giving the lecture. Question number 176. Which of the following is correct nursing process order? The options are number A, diagnosis, assess, plan, evaluate, implement. Number B, assess, diagnosis, plan, implement, evaluate. Number C, evaluate, assess, plan, implement, diagnosis. Number D, plan, assess, diagnose, evaluate, implement. وقف الفيديو هنا واختار الخيار بشوف سهل. The correct option is option number B, which is assess, diagnose, plan, implement, and evaluate. اللي اخترنا الخيار رقم B نشوف rational. Think about the steps of nursing process and that the nursing process has 5 consecutive steps: assessment, diagnosis, plan, implementation, and evaluation. So the correct option is option number B, which is assess, diagnose, plan, implement, and evaluate. Question number 177. A nurse calls a physician regarding a change in patient's condition. A physician gives orders over the telephone for start arterial blood gases. Which of the following is the best intervention to be implemented? The options are number A, give order start to health unit coordinator to input in computer. Number B, write down order and read it back to physician. Number C, write down order for ABGs immediately. Number D, call respiratory services start to draw the ABGs. وقف الفيديو هنا واختار الخيار بشوف سهل. The correct option is option number B, write down order and read it back to physician. اللي اخترنا الخيار رقم B نشوف rational. Telephone orders are verbal commands given through a phone by a doctor or someone authorized to prescribe a drug. Legal risks are involved in telephone order because the receiving nurse may misunderstand or misinterpret the order. So, therefore, the order received is recorded and repeated to the prescribing doctors. So the correct option is option number B, which is write down order and read it back to the physician. Question number 178. During cardiopulmonary resuscitation, CPR, for a 75-year-old man in emergency department, the doctor introduced himself as a leader for the CPR. What is the most appropriate leadership style for this situation? The options are number A, autocratic, number B, democratic. Number C bureaucratic. Number D laissez-faire. وقف الفيديو هنا واختار الخيار اللي بتشوفه صحيح. The correct option is option number A, which is autocratic. ليه اخترنا الخيار رقم A؟ نشوف rational. There are many leadership styles. Autocratic style is one of them. It can be described as do as I say. The doctor uses autocratic style when crucial decisions need to be made on the spot, or when dealing with an experienced and new team member and there is no time to wait for team member to gain familiarity with their role. So the correct option is option number A, because the situation is emergency and crucial decisions need to be made on the spot. Therefore, the doctor used the autocratic style. Question number 179. A nurse manager is open-minded, listens to the team, understands others, make change to improve unit opportunities and procedures. What type of leadership style is this? The options are situational leadership style, democratic, compassionate, transformational. وقف الفيديو هنا واختار الخيار بشو صحيح. The correct option is option number B, which is democratic leadership style. ليه اخترنا الخيار ده؟ نشوف rational. Because in democratic leadership style, everyone is given the opportunity to participate. Ideas are exchanged freely and discussion is encouraged. So the correct option is option number D, which is democratic style. Regarding to the other option, situational leadership style, it adapts to the existing work environment and the needs of the organization. And regarding to the compassionate leadership style, it's about balance. It is defined as a way to reduce work stress and increase peace among professionals. And regarding to the transformational leadership style, it's similar to the coach. The leader teaches people how to think rather than just do what they are told. So the correct option is option number B. Question number 180. A nurse manager includes staff in decision-making process. What unit structure is used? The options are number A, divisional, number B, centralized, number C, functional, number D, decentralized. وقف الفيديو هنا واختار الخيار اللي تشوفه الصحيح. The correct option is option number D, which is decentralized. ليه اخترنا الخيار رقم D؟ نشوف rational. Decentralization is a type of organizational structure in which daily operation and decision-making responsibilities are delegated by top management to middle and lower level managers. So the correct option is option number D, decentralized. Question number 181. What is the main limitation of democratic style of leadership? The options are number A, it ignores the incompetent personnel. Number B, cannot be used in emergency situation. Number C, decreases collaboration among the team. Number D, may end up in inappropriate decision making. وقف الفيديو هنا واختار الخيار بشوف صحيح. The correct option is option number B, which is cannot be used in emergency situation. ليه اخترنا الخيار رقم B؟ نشوف rational. In democratic style of leadership, decisions are made by the whole team and require meeting and sometimes extended period of time to reach agreement. Therefore, it is not suitable in time of emergency. So, the main limitation of democratic style of leadership is it cannot be used in emergency situation. So the correct option is option number B, cannot be used in emergency situation. شكرا جزيلا، إن شاء الله نتقابل في المحاضرة الجاية. Don't forget to support us by comment, like or subscribe.